and I'll do a proper introduction. Okay, I can now see that we are connected to YouTube Live. So yeah, second welcome to everybody. So thank you very much for everyone who's joining us on Zoom and YouTube for tonight's webinar, which is managing tendon and ligament injuries in horses. We're always so pleased that so many of you attend these live webinars. And I'm just going to do the normal plug about making sure that we can continue to support wild horse welfare and ultimately horse welfare in so many ways. One super easy way is by encouraging friends and family to attend these webinars live or watch them back. They are all available on our YouTube channel as well, on our education channel. But anyone can register for free, as you'll know, to watch it on Zoom. And we feel that watching on Zoom is definitely the best way, as you can participate in our polls as well as ask questions using the Q&A tab as well. But as I said, you can also watch it live on our YouTube channel, or by subscribing to our YouTube channel, you can then watch it back later at any time. Hopefully Basil will be dropping some links in the chat now to make sure that you can access our subscription channel as well. So tonight I'm really happy to be, as I say, we're talking about managing tendon and ligament injuries. And we've got vet Mary Smith as well as equine physiotherapist Kim Gunstone to talk to us all about tendons and ligaments. As always, this is a two-way conversation. So please, you can use, for those on Zoom, to use the Q&A tab below. You can obviously put any comments in the chat, but please do put your questions into the Q&A tab. Anybody watching on YouTube, you can use the chat function in YouTube to ask a question, and we will magically whisk your question over into the Zoom Q&A tab so we can get Mary and Kim to answer those questions for us. Those again on Zoom, if you're watching it, please upvote any questions you'd like answered. We normally get far too many questions. So please, let me know which questions it is that you want me to ask Kim and Mary as well, please. And obviously, please share your views continuously throughout. We do really hope you, as I say, are going to enjoy today's discussion, and please do share it with others and friends and family. We really rely on your ideas for our future webinars as well. So if you want to let us know either in the chat or on our email, which is education@worldhorsewelfare.org, put any ideas for any topics you might have to send them over to us. So I'm going to start by quickly sharing my screen and ask a poll question. So the poll question we have tonight is, have you managed a horse with a tendon or ligament injury? So that should now be live. While you are answering that question, I'm going to take the time to quickly introduce Mary, and then we'll come back to the answers. So we're really happy to have Mary joining us. Mary is an equine specialist, as we can see, a PhD examining different MRI methods. She's worked at Newmarket Equine Hospital, where she ran their diagnostic imaging services and worked as an emergency surgeon. She now runs her own independent equine radiology, so thank you for a nice title, service, as working as a freelance equine diagnostic imaging and surgery consultant. And you can also see here that she's serves on the Farriers Registration Council, and also within BIVA, and she's also actually a trustee of Wild Horse Welfare. I asked Mary about a quirky fact beforehand, and although she is very much an equine specialist, she also currently chairs the Southern Thailand elephant organization as well. So foundation, the Southern Thailand Elephant Foundation. So yes, she's learning all about elephants as we go. So I will quickly stop sharing, and if Basil, if you can let us see the results of the poll. Oh, so we're actually, look at that, a nice almost 50-50 split there. So yeah, we've got half of our audience have had to deal with a tendon ligament, and sort of half either haven't or not quite sure. So that's quite an interesting thing for you to start with, Mary. So do you want to, I'll just pass over to Mary now, if you want to get your screen ready, Mary, and we can go from there. That's all looking great. I'm going to mute myself, and thank you very much again, Mary.
Thank you very much, Alana, for that kind introduction, and good evening, everybody. It's always a pleasure to be here and to be joining you all this evening. It's a great topic, management of tendon and ligament injuries in horses, and it's a big topic, but I'm going to try and give you a sort of a whistle-stop tour through some essentials in the next half an hour or so, and then of course we'll have plenty of time for the Q&A. Hang on. So what are we dealing with when we think about tendons and ligaments? I've shown a schematic here of the equine lower limb with the main players in a beautiful sort of colour scheme. We're going to talk about the superficial digital flexor tendon and the deep digital flexor tendon, and then the suspensory ligament and its body and branches today, really. But of course, there are a number of other tendons and ligaments that we need to be mindful of and that we often end up having to work hard on when we're dealing with injured equines. Just as a refresher for you, tendons connect bones and muscles, and ligaments connect bones and tendons to bone. So they have a different role. Anatomically, they are also different in structure, and that does have an implication in terms of how they heal when they are injured. What about some statistics? Well, unfortunately, flexor tendon injuries are high up there in terms of what might happen to any of our equine athletes and to even our pleasure horses also. They account for approximately 35% of all injuries to flat and national hunt horses, with 53% of injuries during steeplechase races being flexor tendon injuries. In one given season, approximately 15% of national hunt horses will be affected with a tendon injury. Of all of those tendon injuries, the absolute majority, 99% approximately, affect the forelimb, and a high percentage, 75 to 93%, affect the superficial digital flexor tendon. We'll just go back to our schematic. So that's the paler yellow structure that runs all the way down through the back of the carpus, the back of the knee, all the way down and inserts around about the distal pastern area, the lower pastern area. So our superficial digital flexor tendon is number one for those race horses. Of course, event horses suffer very similar injuries, but to a slightly lower degree, given that they're not working at quite such high intensity. Of all injuries sustained, 43% will be a flexor tendon injury. And you can see that, again, the majority are superficial digital flexor tendons, with a smaller number being the deep digital. And then generally within event horses, 31% will have a suspensory ligament injury. So those three structures, the superficial, the deep digital flexor tendon, and the suspensory ligament, form a huge percentage of injuries sustained by our horses working. Of course, the pleasure horse population will suffer injuries of these structures too, to a lesser degree, thankfully, for pleasure horse owners, but of course they're still important structures, and it very often is one of these that we're dealing with when we have a lame horse. Let's look under the microscope a little bit and try and understand some of the composition of a tendon and why it is they work as they do. They are really quite beautiful structures, and you can see that sort of glistening, shiny, wriggly structure there on that photograph to the left. That's a close-up of a post-mortem section of a flexor tendon. And you can see the undulating, the wiggly surface, and that's illustrating what we call the crimp. And the crimp is literally a bunching up of the tendon fibers that straightens out in the initial phase of tendon loading during exercise. And that's what gives tendons its elastic nature, which allows it to act as a store for energy, giving horses that ability to move at speed. The crimp is distributed differently over the cross-section of tendons, depending where we are anatomically on the limb. Tendons themselves have a huge proportion of their structure is composed of what we call an extracellular matrix, which we can think of as the scaffold. And within that scaffold, we have glycosaminoglycans, the GAGs. They are an important molecule within that framework supporting the tendon. The tendon itself has two key components, the comp and collagen. And these two structures are structures that are components that we measure to understand a little bit more about how tendons are deteriorating and how tendons are healing when we do research into these sorts of injuries. Another schematic really just showing you how we get to our tendon structure. So moving from left to right, you've got some precursor alpha chain molecules, and they bunch up as a triple helix, which bunches up again as a collagen molecule, which bunches up again as a collagen fibril. The collagen fibrils join together a bit like a bunch of picker sticks, and then those join up to become the collagen fiber. The fibers join up to be secondary and then tertiary fiber bundles, and that's how the entire tendon is made up of a lot of these longitudinal fibers all working together, unit after unit, superimposed and adjacent to one another. So it's a very linear longitudinal structure that makes up the tendon when we look at it in detail. The pathophysiology of tendonitis. Here's some depressing news if we aren't too careful about thinking about it. The pathophysiology of tendonitis tells us that, unfortunately, even if a horse stands in a field and really doesn't do anything much else, their tendons will be aging and deteriorating with cumulative fatigue damage, with little or no ability to repair or adapt. And that's quite depressing, really, when we think about it. But there we are. We're all just, all of those tendons are just wearing through time. When we think that we then add to that a job, some exercise, and we put increased load on the tendon structures, we consider the speed at which we might be exercising horses, the ground surface, the type of shoeing, all of these things will contribute to accelerate that aging process and that deterioration. And I think you can start to then see why it is that clinical tendonitis or a lameness due to a tendon injury becomes so high statistically in our population of injured horses. Whoops, a daisy. I'm just going to try and move on. Saying no at the moment, apologies. There we go. So a few more clinically important points about tendons, as well as that fact that they are aging as we watch them in the field even. The blood supply to the tendon is comparatively poor compared with other tissues, particularly within tendon sheaths and bursae. There's a tendon sheath illustrated in that photograph that's very distended, and the green arrows are pointing out some of the upper ends, the proximal areas of distension there in that flexor tendon sheath, showing you how swollen it can appear when it really is distended. And within that sheath, and in areas where the tendon passes through a bursa, which is another fluid-filled pouch, we have even worse or even less of a blood supply than we do within the central area or the mid portion of the cannon regions. Tendons have poor recruitment of inflammatory cells when they are injured. They do heal and they'll heal well, but that healing will be in scar formation rather than regenerating tendon tissue. And so we're up against something that is aging and becoming less elastic as comp and crimp reduce with age. We're up against a structure that is commonly injured, and we're up against a structure which, although it heals, will heal as a fibrous scar, which is not going to be elastic and have those same properties. So we really have to bear in mind all of these factors when we're figuring out how we can get these to heal and how we can get them to remodel as best possible in order to achieve a degree of functionality and hopefully a role for our horses moving forwards. First aid aims. Well, absolutely, without a doubt, some real basics are paramount when we're treating a tendon injury. Get in some anti-inflammatories, some painkillers very quickly, and that will help reduce the inflammation, reduce the swelling, and reduce the influx of potentially further degradative products that come from the bloodstream when something is injured, when tissue is injured. So we want to halt that inflammation or certainly significantly reduce it quickly to try and prevent further deterioration. Cold therapy remains a mainstay of driving out inflammation, and you really can't beat a cold hose up and down that limb multiple times a day to help cool the limb, drive out inflammation, and hopefully encourage the horse to be comfortable also with that cold water therapy. Do we bandage these horses? Well, if there's been a significant tendon injury, we will sometimes see that the fetlock is dropping compared to the sounder limb. And in those cases, some sort of support is needed to allow the horse to load both limbs relatively comparably. So we might need to use a special Kimsey splint. We might need to use just a bandage with some sort of heel wedge to help take the pressure off the injured tendon. And that certainly can be what's required. Having said that, the disadvantage of putting bandages and boots on is that immediately it becomes less easy and therefore less commonplace to be cold hosing these regularly. And it is far more advantageous to them for their healing if they are cold hosed regularly, 4 or 5 times a day even, to help keep that cooling effect going, driving out that inflammation and that filling and preventing that further degradation. Confinement, box resting these horses in the early days is really important also to make sure they don't add to the injury and to make sure that they stay comfortable and don't overload the good limb. So in the initial first days after a query tendon injury, until you're really sure what you've got, we're looking at box rest, anti-inflammatories, cold hosing, and seeing where we go from there with the advice of your vet. What about a steroid injection? Well, depending on the type of horse and whether they are overweight or not, what they do for a living, their breed, a single one-off injection of a steroid can be helpful, again, to halt that inflammatory process and to try and make sure that we're preventing further degradation. If your horse is a small pony club pony who is a little bit on the chubby side and perhaps who's had laminitis in the past, then generally we would probably avoid using steroids because there is that very small risk of inducing laminitis in those cases. After a few days, hopefully by this point, you've had the chance to call the vet and discuss with the vet what we've got and how injured your horse is, and perhaps consider some diagnostics. And one of the early diagnostics to use really would be ultrasound. And the advice we always give is not to consider ultrasound exam on day one, because things won't look so bad on day one as they will look on day 3 or 4 or 5. So usually within that first week, but towards the end of that first week, that's the golden time to get the ultrasound exam booked and to see what those tendons look like in cross section and to decide how much damage there really is. Depending on that damage, getting the horses moving as soon as possible is important. And the reason for that is that we want controlled walking to help try and linearize our scar and to make the functionality of the scar and the healing process as tendon-like as we possibly can to give that horse a chance of returning to the work that they were doing previously. The ultrasound remains an absolute stalwart of the way that we can manage these cases optimally. And the reason for that is that we can use ultrasound to scan the area and compare back objectively to that first scan on day 3 or 4 or 5 and look at how we're getting on in terms of healing. What we're looking for is to see that, first of all, the fibre pattern starts to become more normal. Any core lesions are filling in with normal tissue. And we're looking to see the cross-sectional area in particular is reducing and becoming more of a baseline cross-sectional area. The grey box there shows some graphical data obtained a long time ago now in 1999 by Celia Marr. Dr. Marr was looking at how cross-sectional area of tendon reduces over time in racehorses after sustaining an injury to the flexor tendons. And what the graph shows very nicely is that more or less irrespective of the area or the location of the tendon injury, it takes about 6 months before that cross-sectional area will stabilise and will reach a sort of uniform new level. And that new cross-sectional area might be larger than previous prior to injury, but as long as it has stabilised over sequential exams there, you're ready to start increasing exercise and do more and challenge the tendon with more work. So achieving that status quo and that settled cross-sectional area is important, and we need to be measuring systematically, objectively, with repeat exams to be sure that we've reached that point before we consider doing certainly fast work or anything more advanced than that. So chronic phase, looking at beyond that first month up to really 5 or 6 months out, we're gradually controlling our exercise program. We're gradually increasing our exercise program, but maintaining a controlled nature to that exercise. So really, I would still recommend we don't turn horses out into a big area at any time during this stage, if at all possible. We would want them to have some turnout. We would want them to be able to relax and have some green grass and some fresh air. But ideally, this is in a small paddock, a quiet paddock with perhaps just 1 or 2 companions. It's somewhere that's a contained area, possibly even a round pen that can be moved to fresh grass so that they can't really get up speed and start twirling around and potentially undoing all of your good work. Typically, we warn owners, or we predict that to keep a horse sound after a tendon injury, you're probably looking at realistically achieving a lower exercise plane than you were prior to the injury. And that might be disappointing and disheartening, but what we can mean by that is that instead of eventing hard and going out to as many competitions as you can possibly fit into your calendar, you're perhaps judiciously selecting the events that you want to attend and perform at, and you're doing less, which might still be at that same level if things are going well, but you're doing less of it, and you're being a little bit more discerning in terms of the ground and the going and the type of course and how you prepare your horse. So you're being more thoughtful about what to do, bearing in mind that injury and that scar tissue you need to look after. Some horses just won't get back to that higher level of work, but they will get to something that's still a very enjoyable job and a very enjoyable role. So being prepared to adjust expectations, I think, is an important part of successful rehabilitation. When we're considering how we're going to monitor healing and monitor when our horses are ready to do more, the level at which the injury occurred is important to consider. And for tendon injuries that occur within the hoof capsule, for example, the deep digital flexor tendon might tear within the navicular bursa or nearer its insertion onto the pedal bone in that hoof capsule, we might need something like MRI in order to fully diagnose what's really gone wrong and what's really damaged, and in order to monitor the horse's progress with our rehabilitation. So we're basing our plans and our rehabilitation on accurate diagnostics and on our monitoring that we're doing, which needs to be as objective as possible in that post-injury stage during our rehabilitation. And the more objective we can be, the more likely we are to be successful in terms of returning the horse to a level of work. So what else can we do other than a careful rehab program with controlled exercise? Well, intralesional therapies are commonly used, but of course, these can only be used where we have an overt hole or space present within the tendon. And there's a picture there, an ultrasound image showing a large cross-sectional area of low signal or low echogenicity within the superficial digital flexor tendon in this horse. Apologies, this is not the best ultrasound image, but it's actually within the deep digital flexor tendon that the majority of that injury is occurring there. And that's the sort of injury that we can inject into under ultrasound guidance because we've got enough fibre disruption that there is a space that can contain fluid. So we need to consider whether or not we can inject into tissue. We need to consider whether we have got a lesion like this. And then we need to think about why we are injecting and what we hope to achieve. And it's important to bear in mind that we're not going to slow down our rehabilitation. Apologies, we're not going to speed up our rehabilitation program. We've still got to be just as slow and careful, but what we're hoping to do is improve the speed and quality of the healing and hopefully get a more physiological scar as a result. So intralesional therapies are not going to be a substitute for the long-term rest and the plans and the controlled exercise, but as an addition, we hope they might improve the functionality of that repair. So our various options are really lumped together often in terms of the phrase that the biologics, orthopaedic biologics. And stem cell therapy makes up one of these that's been around now for, perhaps almost 20 years. And in this time, we've come a long way. We've learned a lot. At the beginning, during the early days, when we were researching how best to use stem cells and whether or not these pluripotent cells with no fixed form as yet could really morph into tendon cells if we injected them in the right way. We've since learned that actually what we're probably causing by using stem cells is that we're probably causing these cells to have an impact on the inflammation and perhaps immunomodulate the healing process. Regardless, we do know that without a doubt, using stem cells significantly improves the chance of the horses going back to a job and reduces their re-injury rate, which is fantastic news when we can use these products and when we've got a horse that is amenable to these sorts of treatments. So initially we would harvest bone marrow from a horse's sternobray. We would then we'd then have to send that off to a lab, a commercial laboratory, who would filter this and culture up in extremely precious conditions there, a number of stem cells per very concentrated mill of aliquot. So they'd produce this lovely sort of golden vial of fluid with, a couple of million odd stem cells in there, in theory, in a very small concentration of perhaps just 2 mils. And we could then take that lovely rich fluid and inject it back into the lesion under ultrasound guidance, again done in an aseptic, sterile fashion. So that was how we began using stem cells some time ago now. We developed this sort of idea, and just because it was difficult and there was that delay in terms of sending bone marrow aspirates off for culture to commercial labs, because of a delay in the lab space and the lab time, because these commercial companies were in and out of business and waxing and waning in their availability to us, the development of a bone marrow aspirate as an injectable material evolved. And this involves, again, harvesting bone marrow from a horse and taking that fluid and centrifuging it in-house, provided the right kit is available in-house in the veterinary laboratory. And part of that centrifuge process needs to involve filtration to be sure we've removed all bone spicules. And then again, you're left with a fluid that can be injected into the lesion under ultrasound guidance. Now, compared with using some of the commercial laboratories, the BMAC doesn't have that concentrated number of stem cells per mil of aliquot. You have far fewer stem cells in your fluid there, but actually we don't know that that's necessarily as important as we once thought. Generally speaking, as long as there are some stem cells in your fluid, potentially there's going to be that immunomodulatory effect, which is the good part, the good result. So potentially this might be an option if the right equipment is in the lab, the practice, and the right staff and personnel who are specially trained are available to use the centrifuge correctly. and to create this beautiful fluid that can be then used as your intralesional agent. What else do we use? Well, PRP, or platelet-rich plasma, is commonplace. This is a lot simpler to make, which is the good news. And from the horse's perspective, just involves a blood sample rather than having a bone marrow aspirate, which is simpler for the horse also. What we're doing here is we're collecting a blood sample using a special kit, and then we're filtering that blood or centrifuging it, depending on the collection kit. And then we're ending up with a platelet-rich concentration of fluid, with the aim that we're going to inject that back into our lesion, and that high number of platelets are hopefully going to stimulate angiogenesis or stimulate new blood vessel formation. They're going to stimulate the proliferation and the differentiation of tissues in that environment, which we hope are going to be more tendon-like in theory. So we've got many benefits from the use of platelets. So they're going to cause clot formation when tissues are injured. They are going to produce a degree of inflammation that is chemotactic and will call to arms some of the other growth factors that we need for good healing. They're going to encourage cell proliferation and cell differentiation and an all-important angiogenesis or new vessel formation. So lots there that we can achieve using that lovely PRP. So the aim with all of these biologics, stem cells in particular, but certainly PRP also, any of these, is to achieve as functional a repair as possible. And as a result, hopefully have a structure at the end of the healing process and at the end of the rehabilitation process that can stand up to the work that we would like to do, and therefore have a reduced re-injury rate compared with standard rehabilitation programs. When we're looking at how these are getting on, ultrasound is the mainstay to objectively assess how our lesions are doing. And you can look at these longitudinal images in particular, which show these are ultrasound images looking from left to right. Top to bottom is skin to deep. And on these 4 ultrasound images from top to bottom there, you can see the central area of the darker grey speckles gradually filling in and becoming much more uniform and much more pale grey as that tendon lesion heals. And in that bottom left image there, when you're about 12 weeks post-implantation of your stem cells or 17 weeks post-injury, that the tendon, the SDFT, is still large, it's still round, it's still fat, but it's of much more uniform echogenicity. The speckles are much more similar across the tendon. We can't see that central large lesion anymore, and things are really going along the right way. Apologies, the computer is jumping around. There we go. So, does the location of the injury influence the likelihood of healing? Well, it does, and it's something we must bear in mind. Racehorses will typically injure their flexor tendons in that mid-cannon region, the metacarpal region, and that's where the tendon is most elastic and possibly going to be most at risk of being strained and deformed beyond repair during high intensity exercise. Those regions generally seem to need a longer time off, although they can heal and repair, perhaps they are susceptible to re-injury. Lesions within the bursae and the tendons are surrounded by fluid. So when we have a tear in a tendon and any of those structures there, those will not heal well on their own if left to their own devices, and they may well require surgical debridement to get those to finally heal. But having said that, once they do heal, then they potentially have a slightly higher likelihood of returning to exercise or returning to the level of exercise than before, that they were in before, compared with perhaps those mid-metacarpal lesions. Again, depending on the size of the lesion and how much tendon is really affected. And it's me. There we go. The deep digital flexor tendon is a good example of a tissue with variations in collagen deposition. And the reason I've put that statement is again, to back up this idea that depending on the level of injury, the tendon will do more or less well in terms of how well it can heal. In that mid-metacarpal region where it's very elastic, there's lots of type 1 collagen. In the actual fetlock canal, so at the back of the fetlock where the tendon passes around an angle of the fetlock there is more type 2 collagen, which is generally a little bit more resistant to compression, which is a good thing as the fetlock is extending and flexing. And in those levels there's less elasticity to that flexor tendon, the flexor tendons, but perhaps those tissues are a little bit more prone to chondroid metaplasia or becoming a little bit more calcified and more dense. The suspensory ligament is even more varied than the flexor tendons in terms of its composition. Evolutionary, we know that the suspensory ligament is really an interosseous muscle. There's quite a number of muscle fibers and some adipose islands within that origin of the proximal suspensory ligament at the level of the top of the cannon bone in either the forelimbs or the hind limbs. And that has implications for healing of ligaments, or this particular ligament. And it has an implication in terms of our ability to assess these on ultrasound, because the different tissue types can make it confusing when we're trying to understand whether we have got fiber separation and tearing, or whether actually it's just the composition that's making things look different on our ultrasound scans. So thinking a little bit more about suspensory ligament injuries now and comparing back to our flexor tendons, how do suspensory ligaments do when they are injured? Well, the multiple tissue types present in the origin have a larger vascular component, unlike tendon tissue, and that's a good thing on the whole. In theory, it'll mean that there's a stronger inflammatory response, potentially an influx of some of the good cells as well as the bad. That will mean the healing process is perhaps a little bit more rapid, or a little bit more impressive, if you like, than the healing process we might expect from the flexor tendons. What we have to bear in mind, though, is you can see on this photograph of a post-mortem section, there's the cannon bone at the top of the screen, and then to the left and to the right of our superficial of our suspensory ligaments, our proximal suspensory ligaments, which is marked by the red arrow, we've got bone. So on three sides of the proximal suspensory ligament, there's a bony cage, if you like. And then on the side that's to the bottom of that image, before the flexor tendons, so the side that we call plantar in the veterinary world, we've got a thick retinaculum, and that's also acting as a strap containing that proximal suspensory ligament. And while that's a good thing when things are well, as soon as that ligament becomes injured and potentially inflamed, the strap-like nature is a hindrance and can prevent can cause a horse to be uncomfortable, and can be the cause itself of the lameness, because there's nowhere really for the swelling to go. So some of these horses can be lame because they're literally they would ideally have a swollen area or swollen ligaments, but there's nowhere for that swelling to go, and so the ligament becomes very tight and restricted, and that's painful in itself. So sometimes they don't look particularly disrupted on ultrasound, but you have got quite a lame horse, and we believe compartmentalization by that restriction is why they're sore. When we rehab horses with suspensory ligament injuries, they might improve but not get fully sound. And sometimes in these horses, we're looking at surgical procedures such as neurectomies to try and restore the horses to sufficient soundness to continue with the job. But of course, we need to bear in mind competition restrictions and career limitations as a result. Horses can't compete under rules when they've had a neurectomy. And so that's something that we must bear in mind depending on the use of the horse. Retinacular release, or just buying that ligament some space, is an alternative surgery that doesn't involve denerving and maybe is a different option. I can't resist putting this slide in whenever I talk about the suspensory ligament, because it's such an interesting structure. And one of my loves is diagnostic imaging. And here we've got an ultrasound image to the left, and then an MRI image of the same area in the middle, and then our post-mortem section to the right. And I think the point of this slide is really to show you how invaluable MRI of the proximal suspensory ligament area can be in order to fully understand which tissues might or might not be injured. And you can see, I think, hopefully how much more detail we get from the MRI, and how like a post-mortem specimen it is compared with just ultrasound alone, which, whilst useful, is a difficult modality to fully understand and appreciate all of the potential injuries that the horse may have when they have a proximal limb lameness. Here's another example of that. This is a horse that had a lameness that was localized to the area of the origin of the proximal suspensory ligament, but you can see on this single MR image that quite a chunk of the proximal metatarsal region was abnormal. We've got a wedge shape of low signal bordered by a black line, and this is actually representing bone edema within the proximal metatarsal bone, and is very consistent in appearance with a stress fracture in that bone. So when we're managing horses with a ligamentous injury, if things aren't going quite as we would expect, given the peer-reviewed literature and given the advice of our vets and our physios and our support staff, if things aren't behaving in the way that we would expect, it's very important to consider the diagnostics and look at what was diagnosed and what was done exactly, and decide whether or not re-evaluation is required, and we need to reach for different imaging modalities to be sure that we've really considered all of the structures that might be part of the lameness. So as for tendon injuries, we're managing our suspensory ligament desmitis cases in a similar way. We're stopping work. Some horses are okay to keep walking, but on the whole, we're significantly reducing all work, and we're restricting them. We're restricting our turnout to calm and contained spaces. Wherever possible, we try to minimise box rest because horses don't do well on it, both mentally and physically. Other areas start to become stiff and perhaps less than optimal. They might suffer from osteoarthritis that then is exacerbated if they're box rested. And certainly for their mental health and well-being, it's not good for them to be box rested for long. So wherever possible, we're looking at reduced turnout spaces and calm and quiet areas rather than strict box rest. The forelimb proximal suspensory ligament will generally be more amenable to treatment than the hind limbs. Again, we're thinking about our non-steroidals, and again, we're thinking about the use of some of our biologics. In the hind limb, particularly when we have a proximal suspensory ligament desmitis, we're looking at core strengthening exercises to try and work on the top line musculature, hill work, stepping over poles, the use of side reins. All of these things will help horses strengthen and carry themselves in a more optimal way, and that in turn will take the pressure off some of these precious ligaments. This photograph of a horse to the left there just shows you what a straight-limbed conformation might look like, and unfortunately this sort of conformation does predispose a horse to straining their suspensory ligaments despite best efforts, and unfortunately it can be difficult to return those sorts of horses to soundness. So conformation is important, it is key. Last area to consider really in this whistle-stop tour are our branches of our suspensory ligament, which are frequently injured. This is a photograph top right of somebody palpating that branch, and you can see how they run distal and insert at the back of the fetlock on one of the proximal sesamoid bones. And there's a lateral and a medial, or an outside and an inside branch. So two branches there in that distal or that lower third of that cannon region. Typically, they are more forgiving as injuries than the proximal suspensory region or than flexor tendon injuries. PRP is a very popular choice of a biologic that we might choose to inject if we have got an overt core lesion. We think that its best mode of action in these ligaments is by stimulating fibrosis, which is generally useful in these branch injuries, whereas in the flexor tendon, it's almost the last thing we want. We want a more elastic tissue. On the whole, our branch injuries need a shorter rehabilitation time, and on the whole, these horses will go back and do more or less what they were doing before with care. Some adjunctive therapies I'll touch on, although I know that Kim will talk a lot more about physiotherapy, so I certainly won't go into that territory, but potentially shockwave therapy may help us, certainly less so for flexor tendon injuries. We think it's a little bit too severe, but it can be very useful to sort of kickstart suspensory ligament healing when things are not progressing as quickly as we would like. But again, it comes with a caveat that it needs to be used judiciously. The protocol needs to be considered, and it's very important we don't do too much too soon. Laser therapy, water walkers, hydrospas, swimming pools, all of these adjuncts are useful additions to help work the horse in a controlled fashion and allow them to perhaps maintain aerobic fitness and upper body core strength whilst not overloading their limbs. And finally, just to touch on some surgical therapies, some tendon and ligament injuries will need a surgical treatment. And we've already talked about a neurectomy for that suspensory ligament, the proximal suspensory ligament. We'll touch on that again in a slide's time. But there are other tissues that are constrained by various annular ligaments or other retinaculi. And sometimes we need to transect or cut those structures to give the injured tendon and tissue a bit more room. And just by doing that, we can restore a horse to more comfortable degree of mobility by giving the injured area a bit more space to allow it to be swollen but healed, and therefore still be a functional tissue to allow the horse to do a job. And touching on that neurectomy again, it's the deep branch of the plantar lateral nerve is the anatomical nerve that we end up transecting quite deep within the proximal aspect of the hind limb, and then potentially transecting the retinaculum overlying the suspensory ligament as well buys that swollen ligament some space. Provided we've got a good conformation and some angulation to the hock, then primary suspensory ligament desmitis cases will often do extremely well if they require this surgery, perhaps 78% going back to their original role. But those horses with a straight hocked conformation seem to do less well. So it really is a case of picking the horse for these procedures, and it's not going to be the solution for everyone. Of course, as with every surgical procedure, there are sometimes complications, and you can see on the picture on the right, there's an arrow pointing to a lesion that's an iatrogenic injury created at surgery by cutting a little too deep and actually cutting into the suspensory ligament itself. So some take-home messages as my sum up. Tendon tissue is progressively degenerating even with little to no exercise. Microdamage accumulates prior to the onset of tendonitis or a ligament desmitis. It's not a one-day event. The day they become lame is the end stage, and actually that accumulation of injury is probably what's been going on. There isn't a quick fix for any of these injuries, but what we need is a progressive increased exercise plan supported by regular objective assessment of the area of damage, and that's key if we're going to return these to work. The work is most likely to be sustainable if it's at a reduced frequency and or a slightly lower level, and that really depends on how much of the injury we had, how much of the cross-sectional area was injured and how severe the injury is. Foot balance, without a doubt, is a key component to maintaining soundness. Branch injuries are more forgiving than the proximal area of the suspensory ligament, and hind limb conformation and core muscle stability will reduce injury rate. So what can we do? We need to go a little more slowly where we can. We need to avoid pushing our horses to that fatigue stage. Avoid firm ground wherever possible. Cool those limbs off immediately after fast and hard exercise. Really cool them well and vigorously multiple times. Avoid hard exercise when the horses are overweight or unfit, because all of those things will push them over their comfortable limit and are likely to contribute to that micro damage, if not tip them into an overt injury itself. Prevention is always better than cure. Developing and maintaining core strength, paying close attention to the farrier and the foot balance, all of these things will help support our horses' tendons and ligaments and keep them sound for longer. And that's really all that I would like to say at this stage. Thank you so much for your attention and for listening. But of course, we're here and we're about to enter a Q&A session. I'd be very happy to answer your questions.
Oh, wow. Thank you very much for that, Mary. That's doing very much as a whistle-stop tour of a lot of information. So yeah, and I think I was definitely sort of guilty of thinking that a lot of these, either ligament or tendon injuries would have been like one catastrophic event that sort of done it, rather than actually thinking about that long-term impact that actually just everyday wear and tear is having on our horses. So no, thank you very much. Before we introduce Kim, I just want to just quickly take this time to plug our next webinar. Well, we've got a nice sort of a nice big audience. So can I just remind everyone, our next webinar will be in 2 weeks' time. So that'll be Wednesday, the 26th of March, and we're going to be exploring how horses learn and how we can apply learning theory to when we're riding horses. We'll be joined by behaviourists and trainers, Trudy Dempsey and Justine Harrison. So please do sign up to attend that next webinar. So as Mary said, we are going to be now heading into our Q&A session, and I'm going to first of all invite Kim to join us as well. So Kim Gunstone, I'm going to share my screen and quickly introduce Kim. So hopefully, we can see here. So Kim is an ACPAT chartered physiotherapist, treating both animals and humans, riders in the Tayside and Fife area. You can kind of see, we can see then from the slide that she qualified from Robert Gordon University in 1999 in physiotherapy, undertook more training in 2005 at the RVC, and then qualified as a veterinary physiotherapist in 2007. As I mentioned, she does treat humans as well as horses, and treats particularly riders and jockeys. So has a wealth of experience working with elite sportsmen and women from across the equine sector and from many other different sports as well. In 2011, she worked with the British curling team has provided physiotherapy support for the Scottish and GB teams at the World Championships, World Junior Championships, and World University Games. And Kim herself is no stranger to exercise as well, and she told us before that for her 40th birthday, she decided she would run the London Marathon. So that is a very dedicated thing to want to do for your birthday, Kim. So I will quickly stop sharing, and thank you very much, Kim, for joining us today on this webinar. So I'm just going to sort of get the ball rolling straight with you, Kim, actually. Can I just ask, like, how, from a physiotherapist point of view, how can regular physiotherapy help to prevent tendon and ligament injuries?
So I think that's the key, is prevention. And if you know a horse, and if you're working with an uninjured horse, you get to know what normal is, and you can assess for any asymmetries or imbalances, any weaknesses, any restrictions in movement, because ultimately any of these problems can lead to overload of certain tendons or ligaments and cause or add to that degeneration that can cause injury. So if you can identify a problem and try and reduce it and address it, you're reducing the risk of injury. And this can take the form of direct physiotherapy treatment to your horse. You could also give the owner some exercises to do to try and prevent or address some of these problems as a maintenance. But it's working with the whole team. So you could be liaising with a coach or instructor to adapt and alter an ongoing training program. It could be discussing with a farrier that consistently we're finding a particular area of a horse a problem, and is there anything that they can do from a foot balance or a farrier perspective, and also working with saddlers, looking at the balance of the rider, because rider influence on the horse is quite important as well. So if you're working with a chartered physio, then we can also look at rider balance, because any asymmetries will transfer onto the horse. So ideally, prevention is the most important bit. But if we do know the horse regularly, we can pick up on minor changes and then hopefully pick up on any injuries that may be occurring before they become catastrophic or major. And you can get the vets involved, get some scanning done or investigations to see if there's something that needs treatment now, or if it's more of a training and management program. So yeah, regular maintenance work is really quite useful in preventative work, and that is definitely better than treating an injury.
I can imagine, and I think, and obviously, just what you said just ties into exactly sort of what Mary was saying about this being sort of an ongoing sort of little tears and injuries here and there, rather than always it being sort of that one big thing. Just to remind everyone that if you're watching either on YouTube or on Zoom, that you can pop your questions into the Q&A tab now. I can see some coming in, so thank you. But if anyone else has a question, now is your time. Mary, you have touched upon this, but I would just like you just to again go back to, like, is there a certain link between certain disciplines and particular tendon or ligament injuries? Do we have any data on that?
Well, we do know that the horses that work fastest and hard are the more likely to suffer the flexor tendon injuries. Of course, as age increases, then those tendons are going to be more at risk in every horse, in every discipline. But in a young, healthy horse, then the faster work that they do and the more often they do that fast work, the greater the risk that they might be of having a flexor tendon injury. Horses that do a lot of twisting and turning, so perhaps your show jumpers, we believe they are more at risk of suspensory branch injuries. Horses that jump potentially are more at risk of proximal suspensory desmitis, but then we also see that as a repetitive injury in our dressage horses that are working, obviously on the flat, but they're doing that repetitive, intense work that uses their back end and uses their suspensory regions, if you like, underneath their bodies regularly and frequently to achieve the movements that they do. So that's an example of repetitive strain, if you like, as opposed to that jumping effort causing a more intense strain of those ligaments. So we can apply a discipline and a type of horse, and some injuries will marry up very nicely and others are just really across the board.
And it does tend to fall more within the sort of the discipline and what they're doing, rather than potentially like any breed or necessarily sort of age related.
Yes, I mean, horses that are the right sort of horse for the job will be more injury free than horses that are doing a job that's perhaps a little bit above their conformation and ability. And an example might be, cobs are wonderful all-rounders, and you'll see them being very versatile, perhaps jumping, perhaps dressage, but their frames, bless them, are not perhaps as athletic as a sports horse type horse or a thoroughbred. And perhaps we might expect to see a cob doing higher levels of dressage, perhaps being a little bit more at risk of ligament strain than perhaps a horse that is more of a sports horse cross, a thoroughbred cross. So the discipline that your horse is doing and the level at which you're achieving might have an impact on your horse if they're not of the frame that's ideal for that athletic discipline.
Interesting, thank you. Kim, so when you're helping owners that are managing, so we haven't managed to prevent, we're now managing a horse with a tendon or ligament injury, are there any particular go-to rehab exercises that you would recommend?
Uh, that's quite a difficult question, actually. And the simple and short answer would be no. But the reason behind that is I think it's such a vast area that to just say this exercise will help would actually potentially be detrimental in a lot of cases. So we would be looking at the previous exercise of the horse, the previous fitness of the horse, the actual type of injury, as Mary said, where within the tendon or ligament that injury is, how long ago it happened, the degree of the damage that is there, what facilities is there available to the horse and the owner. So are they in a field? Are we having to try and contain them in a small or a smaller paddock area with uneven ground, potentially wet ground, hard ground, depending on the weather? Or are they in a livery yard with nice facilities, concrete areas that are flat and regular, a school with a good surface? Is the horse calm as well? And can we actually take it out, walk it safely? Do we need some other help to do that? Because the last thing we want to do would be prescribe an exercise that would then be detrimental and cause further deterioration of the tendon or ligament. So kind of there's a lot of factors that would determine what you would prescribe a horse in the way of exercise. So yeah, short answer is no. But on saying that, when appropriate, I do love pole work. So yeah, yes and no.
Yes and no. And as you say, like every injury is probably going to be slightly, although it might be affecting like a similar area, is going to obviously be caused slightly differently, and that horse's capabilities are going to be slightly different as well. So all very individual. But who doesn't love a bit of pole exercise? And Mary, you have touched upon this, but I just want to ask again about sort of the viable, like how viable stem cells are as a treatment option for tendon and ligament injuries. And I'm kind of also thinking about sort of from the affordability point of view as well.
It's been a really interesting journey. I mean, when they were first available, we had some one route, and that was a case of harvesting your horse's bone marrow there, which could be done quite simply. It sounds dramatic, but it could be done quite simply for the horse with just a little bit of local anesthetic and sedation. And you get this lovely sort of bloody rich aliquot of fluid that then has to go off to a lab for a month or so and be cultured up into this golden fluid. And there's quite a time delay involved in that. And obviously there's that initial cost of going into your practice or clinic to get that first aspirate done. And then there's a cost for the lab fee. And then there's a cost when you return to have that beautiful golden fluid injected into the horse, and then obviously some sequential ultrasound scans. So back in the day when we were first doing stem cell therapy, there was a cost there of sort of over £1,000, and then of course we've got to bear in mind inflation. So it's not without cost. Now, those days have evolved, and very logically there's been commercial drive to develop allogenic products from the shelf, if you like, whereby another horse in a research environment has been used as the donor for the stem cell product that has been already developed, and so that you can go and buy a product that is already rich in stem cells that you choose then to inject into a horse. Now, this is no longer the horse's own stem cell source. It's from a different horse. So there's a tiny, tiny risk of perhaps inducing some transient inflammation when we use it. It's not a product from their own body, but it seems to be very, very well received and very safe and very well tolerated. And actually that commercial benefit there of being able to just order a stem cell dose when you need it is very, very helpful for vets in practice when we need to get on and treat these horses. And because there's been that commercial interest, the cost has been, a little bit more competitive, perhaps. I mean, it's not a cheap thing to do. You are looking at £1,000+, to be considering this. And again, the case needs to be right. There needs to be a core lesion. There needs to be somewhere to put these beautiful cells that you've spent a lot of money on. So, all of those factors come into the equation there. In terms of the use of biologics, they're well supported by insurance companies who are aware that there's some strong research supporting the use of stem cells. There's been a lot of research showing that there is reduced re-injury rate, which is what we hope to see when horses do have stem cell therapy. So there's certainly a benefit, although we're not entirely clear exactly how that benefit is achieved. So when there is a budget and there are some money and there is insurance money and the case is appropriate, I think absolutely they're well justified in their use, and they're certainly the gold standard that we have really at the moment.
And as you said in your presentation, oh, and although they have obviously massive benefits, they're not that magic wand. They still has to be accompanied by the dreaded box rest, which I'm going to ask a question about, and sort of obviously a proper rehab plan afterwards as well. So
That's right.
so yeah, Kim, I'll come to you. So yeah, box rest is probably something as horse owners we always dread that's going to be a recommendation. But how can how would you advise owners to best manage a horse that is required to have box rest, and how can they best support the horse's physical and mental well-being?
So from a physical well-being, we want to try and maintain as much muscle power and normal range of movement as we can, but bearing in mind that we're managing an injury, so we do have to take that into consideration. I have a couple of kind of go-to exercises, and I know I've just said in the past that I don't have go-to exercises, but for box rest, an exercise that the grooms at World Horse Welfare refer to as wobbles, but basically weight transfers can be nice and gentle, but help maintain a little bit of muscle function. So, and actually the benefit of this is you can do them with the affected limb raised, so you're taken out of the equation entirely if you're dealing with an injury that is that vulnerable. So yeah, I would either using the withers or the hindquarters, or using both depending on where the injury is, just gently rocking a horse from side to side. So nice and gentle, but you get some nice muscle activation there. You can also do it from a kind of rocking forwards and backwards. And again, it's just that transfer of weight and that little bit of muscle activation, a little bit of spinal movement that we're trying to maintain. The other group of exercises that I would use would be your baited or carrot stretches, which are really good for maintaining some muscle function and some range of movement. But again, it would be depending on where the injury was, because you will increase load through certain limbs and certain structures. But I think it can be good for a horse physically and mentally. And you've got to be careful if you've got a horse that's particularly food driven and food orientated. So you could even perhaps clicker train your horse when you're doing baited stretches. And I've done that with my own horse. There's some really good videos by Dr. Gemma Pearson, who's done some lectures for us before on YouTube that you can have a look at on how to best clicker train your horse. But they're my kind of two go-to groups of exercises that I would use on box rest to maintain as best physical and kind of a little bit of mental, as long as you're doing your stable enrichment and other things alongside as well. I don't know if Mary's got any other ideas to add to that.
I think all of those are excellent suggestions, and what I do almost immediately, wherever possible, is encourage walking them out to graze in hand. Obviously, that depends on the facilities and where they are, but even if you can just get the horse to a grass verge, within a minute or two of walking, most injuries, if the horse is calm enough, will allow you to do that. You might need to put a bridle on the horse to be sure you're in control. Of course, the last thing you want is for them to escape and run around and muck about and re-exacerbate an injury. But I try extremely hard not to fully box rest any horse and to have them shuffling out to graze regularly and feel that sunshine. What you're trying to do, hopefully, is if you're in that awful situation of having a fit horse that is suddenly finding themselves confined, what you've got to try and do is somehow break up that day and get them moving and keep them just ticking along a bit, which even if it is just walking out to grass, that will achieve quite a lot, and it will do them a lot from a mental health point of view too, getting them out into that fresh air. Yeah, it's difficult, but you can, the stable enrichment ideas are brilliant. Things like hanging a turnip, using tiny whole hay nets to keep them really occupied working through a hay net so they have lots, little and often, engaging other folk on the livery yard to perhaps share in terms of swapping hay nets and giving your horse top-ups of things when you can't obviously be there if you're at work for chunks of the day. Obviously the last thing you can probably do is suddenly down tools and be with your horse 24/7, but trying to make sure that there's a regular turnaround of people popping and checking, a quiet companion that's nearby so that they're never really on their own for too long. That again keeps them mentally a little bit more relaxed. and really making that bit that's limited to just the box as short as possible. So devising ways that you can turn the box rest into a crew yard area and a bigger mare and foal box as soon as possible, or even one of those round pens. And you can hire round pens from many of the studs out of breeding season will hire round pens. And although there's a bit of faff getting one to a yard or getting one set up in a field, once they are set up, they're extremely safe. And again, at least pen the horse into a fixed spot and can still yet be moved around the field to allow for regular grazing. So you can be quite ingenious if you sort of really put your thinking caps on in terms of how to get the horse fresh air, fresh grass, regular access to sunshine while still being really pretty contained.
I think that's actually really important, isn't it, Mary? That actually the box rest is about limiting the movement, not stopping them being outside. And actually, yeah, as creative as we can be to get the horses out, heads down, but confined. We did have our webinar 2 weeks ago was about actually sort of enriching environments as well. So I'm not sure whether Basil's able to pop a link to that in the chat at some point, but that would also have a lot of other ideas that if we are having to confine, there's some definitely crossover there. We'll now be able to move on to the audience Q&A. So just to repeat, if anyone has a burning question, now is definitely the time. We've got quite a few to get through as well. So there's one here from Maria from YouTube. I'm going to go to you, Mary, first. She's saying, I have a 20-year-old horse who has had previous tendon injuries on his foreleg. Is there any additional supplements or specific training methods that I should adopt to keep him sound?
Oh, so as an older horse, you've got age against you. Now, depending on what you do, if you're doing just generally regular light work, then you've got much more of a chance than if actually you enjoy jumping or doing something a little bit more ambitious with a golden oldie. There are many of them out there doing exactly that, but it'll be easier to keep them sound if they're doing a comparatively low level job. Now, to keep the oldies ticking over, again, trying to prevent them from standing in and standing still too much will help with reducing osteoarthritis, which will help them to carry themselves better. Without a doubt, the older horses do well if they are shod with quite a short shoeing interval. So probably I'd recommend 5 weeks rather than 6, keeping the toes quite rounded and short. So you've got decent shoes. You've got a really nicely balanced pair of front feet, because that will help the horse with their breakover as they're moving. It'll help them be supportive to their tissues rather than sort of clunking along and tripping and stumbling. Making sure they don't get overweight will help them carry their frames a little bit more easily. And actually, I find that the older horses really benefit from physio because it helps loosen off all those stiff bits and bobs and all those aches that they're perhaps used to, but that can just hinder them from moving well and perhaps predispose them to restraining if they're just a little bit awkward and stiff. So, trying to incorporate a sort of routine physio session to sort of loosen off a stiff horse or an older horse is a really great idea. I do feed our golden oldies cod liver oil for what it's worth. It seems to certainly get to their coat, and I like to think that it perhaps gets into their joints a little bit as well. They certainly don't mind eating it. Keeping them turned out 24/7 wherever possible is certainly really helpful for those older horses. In terms of actual supplements, there are so many products you can buy. Biotin is a nice one to keep hoof health well. I really like products like the Hydrus wool fat or Kevin Bacon to keep the coronet band moist and the hoof growing nicely. And I think that's important in the oldies, that they've got strong hoof capsules, good amount of sole depth, and they can take the farrow well, and they can have nice, neat, tidy, sound feet. It really is true. The foot is the gold at the root to so many causes of lameness, and keeping the feet nice and strong and supportive and well balanced will really help them carry themselves and cope with old injuries.
Thanks, thanks, Mary. And sorry, I'm just going to sort of slightly jump on Maria's question here, Kim, for you. Mary's obviously mentioned about sort of physio sessions. Is maybe particularly as the horse gets older, is sort of less but more regular sessions better than sort of one big session every week, particularly if we're thinking about sort of preventing recurrence?
Do you mean from a training perspective?
From a training and physio perspective, yeah.
Yeah, I mean, I think, it goes with every horse, with every age, really. What is your baseline? What are you starting with? So you don't want to change something dramatically overnight, obviously, unless you're dealing with an injury, but from a training perspective. So if you've got a baseline and your horse is sound to begin with, then that's a really good starting point. But yes, I think little and often is better. You don't want that ongoing repetitive load. So yes, shorter training sessions, but if your horse is already working 4 or 5 times a week in sound, then don't just suddenly change it to twice a week because they're older. What they've done in their previous life will affect how they are when they're older as well, and their current joint conditions and their current fitness levels. So yeah, I would say maybe 3 to 4 working sessions a week. I personally always love to recommend at least 1 session a week at walk, no trot work, no canter work, just to reduce the loads but keep the fitness and the suppleness there. Also doing like your box exercises, so your carrot, your baited stretches, and even just your wobble exercises to maintain some of that muscle function without the increased loading. And yeah, as Mary said, horse weight, but dare I mention it, also rider weight. So the load that you're putting through your horse is really important, or lack of load is really important, particularly with your older guys, where we know those tendons are not quite as elastic and not quite as robust as a younger horse would be. Yeah.
Thank you very much. Yeah, I think it's a lot to have to be considering. Well, Kim, I was going to ask you this question from Faye, and I'm pretty sure I saw when it came in, and I think it was actually when Mary was talking about sort of box rest, and she's asked about sort of could this cause any behavioural problems, sort of long-term box rest. Faye, do come back in if I've got that wrong, but that's when I think it came in.
Was that for me?
For you, please,
Yeah.
Kim.
Yeah, I mean, long-term box rest, you're going to have loss of fitness, loss of muscle tone, loss of range of movement, and loss of normal behaviour within a horse. So, yeah, long-term box rest for me, and kind of echoes what Mary said, I would definitely try and avoid at all costs. And yeah, I can't see much good coming of it, to be honest, unless if you've got a really catastrophic fracture or something you're trying to manage, then that's a different scenario. But yeah, I would echo everything Mary says. Where possible, early active movement in a controlled manner is best for body and mind, definitely.
Thank you very much. Mary, I have a question here from Suzette saying, what's your opinion on the use of exercise boots, as this greatly increases the heat of the lower limb area?
Yeah, that's a really good question, because that's the conundrum, isn't it? Some horses are clumsy. They're perhaps a little bit narrow in their conformation. Maybe they brush either in front or behind or all round. And in those horses, and again, if you're doing some jumping or some work where going through uneven ground or in fields and rough bridleways and things, having boots on or bandages on feels comforting because you're protecting the horses from themselves and from the environment. But yes, of course, underneath that bandage, everything is getting quite warm. And we know that heat and excessive heat is what contributes to some of the injuries that we see. So I think you've got to weigh it up, really. And of course, it's better to bandage or boot a horse that will strike into itself than have those injuries occur. But I think don't use them all the time. So if you're doing some arena work one day and you're in the school and you're not jumping thorn hedges, or you're not on a hack where they're perhaps a little bit more exuberant and things are a bit more controlled, perhaps avoid the boots. You can get some of the hard shell boots that are a little bit more breathable than some of the sort of neoprene versions that I think must be quite sweaty for the horse, or seem to feel quite sweaty. So perhaps think about the material your boots are made from. Keeping those boots and bandages on for as little as possible would really be my answer. And I mean, in the racing industry, again, you'll see many horses out on the heath with bare legs because they're going to race with bare legs, and that's what they've got to condition themselves to. And yet those same horses will be stabled wearing stable wraps to help reduce the filling of their lower limbs. So, using them in appropriate situations, but not all of the time, I think can hopefully sort of limit that negative effect.
Fantastic. Thank you very much. Kim, there's a question here from Pat saying, what is the detrimental effect to limbs, if any, to having your horses shod only on the fronts? Any thoughts on having road nails?
I don't think I can really answer that one, to be honest. I would say each horse is an individual, and some horses will require shoeing and some horses will get away without it. So I would default that to your farrier, really, as your best person, or if your horse has had any x-rays looking at foot balance. So I have no personal preference other than saying you need to do what is right for your horse to reduce your risk of injury.
It's certainly possible to manage horses, and I think my advice would be perhaps chat to the farrier initially and ask them what they make of your horse's foot conformation and foot health in general. And then depending on what you're doing, you can always go for a trial period of perhaps a couple of shoeings if you're planning a comparatively low level exercise for a couple of months. I mean, for example, over the winter, if they're just going to be doing some light hacking and really not competing or jumping or doing anything fast or doing too much work on hard ground, then actually maybe just front shoes to keep that foot balance under control and to keep them comfortable would be absolutely appropriate. And generally the weight distribution is of 60% forelimb, 40% hind limb. So the front pair of feet are in theory more in need of shoeing. And so for that reason, many horses would still need fronts, but perhaps manage without hind shoes. But I think it can be a case of trying it and seeing for a short period of time in some instances, and some horses will cope well. But I think absolutely do seek the advice of your farrier and potentially the vet as well before considering it long term.
Great, and yeah, and most, like, pretty much all farriers will be more than happy to kind of talk through the different options that are suited to your horse, aren't they? And
Yeah.
Great, Mary. There's a question here from Alina, asking, would you be aware of excessive cryotherapy reducing the inflammation stage, as this is important for healing?
Yes, I mean, by cryotherapy, we tend to think about ice and really cooling down tissues to a significant degree. And absolutely, that can be detrimental in itself. That can really damage or cause, cold burns of tissues. So I think absolutely, I'm not sure that I'd reach for cryotherapy in terms of trying to reduce inflammation, but so some of the boots where they really are, ice boots or boots involving a lot of very cold water, maybe that is too detrimental if it's done too often and for too long. When we put ice wraps on horses' limbs, it's always really important to have an inner sanctum of a soft bandage dressing and never put ice packs directly onto their skin, because again, you can cause some thermal injury that way. I mean, for me, the most useful thing is hydrotherapy. So using water, which doesn't have to be ice cold, it just has to be cold. In the olden days, standing a horse in a running river or running stream was common practice with farm animals and farm horses. And, that really was about driving the filling out of their limbs after a hard working day. And if you're using a hose on the yard and you've got your finger over the hose to generate a bit of pressure and you're running the hose up and down the horse's limb, what you're doing is doing a bit of stimulation of that limb. You're perhaps shifting some of the accumulation of lymph if they're getting a little bit puffy and filled after hard work. You're reinvigorating the limb a little bit. So doing that sort of hydrotherapy for perhaps 5 or 10 minutes 2 or 3 times is more advantageous than doing it once for half an hour, because you're coming back to a warm limb. You're going up and down the limb with the hose. You're driving out any accumulation of limb edema or lymph in those tissues and bringing a fresh vascular supply to that reinvigorated limb, if you like. So for me, hydrotherapy is great. Too cold a therapy could be detrimental to tissues if it's done for too long and too often.
And things like that, obviously, just be obviously following the advice of your vet at that point in time, isn't it? Over the best.
Yeah.
Kim, there's a question here on YouTube about immediately post box rest. So just after we've done some box rest, how can we balance controlled exercise with any potential rebound behavior the horse may be showing?
I think you need to think about the environment that you're working them in for a starting point. So don't go to a wide open field and try and do some controlled walk work. So if you've got an enclosed area, enclosed arena, school with a good, nice uniform surface, that would be a nice starting point. You might want to take the horse out with a friend if it's a calming influence rather than an excitable influence. Pick a time if you're on a busy yard where it's maybe not as busy, where it's quieter and there's less stimulus there as well. And yeah, your individual horse, do you feed them before you do your controlled exercise or after, or yeah, what works best for your horse? But I would say good luck.
Thank you. There's another question here from YouTube for you, Mary. So does cross training on different surfaces help to reduce the risk of horses developing a tendon or ligament injury?
The simple answer is yes, we believe so. There's a lot of research in this, particularly with the racing industry and the professional sports horse industries, And we absolutely believe so, because what you're doing by changing the surfaces is you are conditioning different parts of the horse in different ways. And so you develop this all-rounder, if you like, that has, perhaps there's been some bone strengthening activity with some of the firmer surfaces, but then the muscles and the soft tissues are working differently on some of the more giving surfaces. So having those differences and that variety, for sure, we think helps to stimulate all of the different tissue groups, rather than just doing an excess of perhaps road work or an excess of just arena work. They need that real balance and that real mix up. And certainly, we know that a combination of hill work and flat work is better than just one or the other. It does the horse's mental health good if they're having a change of scene constantly and going to some different environments too. So yes, absolutely.
And, Kim, there's another question here, and it's come through from Eileen on the chat, and I'm only letting it in because Eileen is able to sway it this way. But and it ties into actually what Mary's question was just there. So she's saying prevention is better than cure, and as you say, the old way of thinking would be to walk for 6 weeks or so to harden up the tendons. However, with hacking not being so safe these days, we don't really see many horses getting out of the arenas as much. So how would you advise an owner to best prepare their horse, particularly if it's maybe been roughed off over the winter or something?
I still think it's important to do a good grounding of walk work, but I think it's important to offer variety within that. So if you have the luxury of having a facility where there's different surfaces but still within a school environment, then you could work in different schools. So we're doing what we just chatted about and trying to introduce a difference within the training. But if you've got the same facilities, mixing it up, as I say, pole work I love. So you can do lots of different scenarios with poles, working on transitions, and people always think that's at speed, but even walk to halt can be a nice transition. Working with the poles, sometimes just doing your basic flat work, and even adding in more of your kind of schooling elements. So doing some circles and figures of eight, some lateral work at walk before you introduce the higher impact trot and canter work. But also even just within if you're in a yard scenario, walking, using from your stable or from your field to a school, that is a different surface. That's not going to be a schooling surface the whole way. So using those environments to do a little bit of work to and from the school, or if you have an area where there is a hill, even in hand walking your horse up and down a hill, again, to get that variety, to get that change in movement, is what I would suggest within your 6-week plan, and plan it. So have a day where you do poles, have a day where you do more schooling, maybe have a day where you do in work, so that you can look back and go, we've covered all this, to get that variety that you can't do when you're out hacking.
I think I'd encourage people to consider, that walking exercise as part of the fun as well, and perhaps think about a short trailer or box ride to where there's a different bridle path you've perhaps not been on before, or maybe a walk through some woodland, or on a private estate where there's perhaps access for whatever reason. Go with a friend, plan that is going to be a walking activity. No one's going to go fast or be silly. Of course, you need to rely on your horse not being overexcited and fresh, because it's an exciting new environment. So it would depend on the horse. But I think making a short journey and then that walking work somewhere different, that will be interesting for yourself as well as for the horse. And if you can do it in quiet company, all the better, really. So I think don't feel that all of this rehab work has to be stuck at the yard in the same facility, in the same arena, going round quietly and slowly driving yourselves all potty. You can try and be a little bit more imaginative, and as long as it's staying at walk, you're benefiting hopefully by perhaps discovering some new lovely spots, only perhaps 10 minutes box ride away or trailer ride away, where you can make use of some different facilities.
Quite often you can have like cross-country courses that are available for hire, so you could hire it and walk around it rather than using the jumps or anything. So yeah, there's lots of safe environments out there you can access if you have availability to travel.
Fantastic. I'm just noticing the time, so I think we might only have time for a couple more questions. So I'll come to you, Mary, with this one. So how common are check ligament injuries, and are they managed as the same as the suspensory ligament injuries?
Oh, thank you. Yes, that they are common. Common again, more common in the older horses, a little bit perhaps more common in ponies and than perhaps in the larger horses, but they certainly are common. They're common in jumping horses. And generally speaking, they are more forgiving than the main flexor tendon in terms of how they will survive and how they will rehab and how the horse will be getting back to work. You won't always have the most beautiful cosmetic outcome with them. There's quite often persistent thickening and swelling when a horse has sustained a check ligament injury, but they can certainly return to soundness more easily than perhaps the flexor tendon injuries. So yes, I generally in my mind am more relieved to have a check ligament injury than I am to have a main flexor tendon injury. So certainly, again, there are a few surgical procedures that can be done to help improve on them if they're not quite sound, but going along nicely after significant rehab.
Fantastic, thank you. And Kim, I think this will be the last one for you as well. So it's from Sarah Jane asking, how soon would you be introduced low-level work, such as pole hill work for suspensory injuries? Is this going to be post-healing or is this part of the process of healing?
Yeah, it's part of the process of healing. But on saying that, I would be working with our vets if they're doing any imaging to make sure that we're getting decent healing going on, then assessing for lameness as well. So as soon as your horse is allowed to do a little bit of controlled work, I wouldn't start pole work straight away because it will be changing forces and angles. But if you've done, I would say, it's hard to say because it depends on the degree and the nature and the site of the injury. But if you've done a good couple of weeks, very minimum, but possibly about a month of in-hand work and your horse is going well and it's not too excitable, I would start to even just walk over one simple pole to begin with. And then I would make that process more complicated as time progressed and as the lameness improved.
Fantastic. Thank you very much. And I'm really sorry to everyone, we've not managed to get through all the questions tonight. There's been loads coming in. We do, however, have a ligament and tendon advice page that, again, hopefully Basil, who is having to work quite hard tonight, will drop the link in for that. So if there's any questions that we haven't managed to answer, that the answer may already be on this page. And if not, I'm sure you can speak to your vet or feel free to email in and we can try and get an answer for you as well. So thank you both, Mary and Kim, so much for your wisdom and knowledge tonight. I think we've all certainly learned a lot. Mary, could I just ask you I know you've already your take-home message in the slide, but if you were to just sort of give everyone who's here just a very quick take-home message, what do you want us to go away with?
Oh, for me, it's foot balance every time, making sure you've got nicely balanced feet, short toes, a short shoeing interval, and really you're doing your best there to support the rest of the limb and all of the structures in those limbs thereafter. So absolute, top attention to foot conformation, foot balance, and good farriery. And if you're not happy with the way your horse is being trimmed and shod, then have a conversation with your vet, have a conversation with your farrier, bring them all together and make a plan for how to make things more optimal because it will reap dividends.
Fabulous. Thank you very much. And Kim, same to you. What would you like all our attendees to take away with them?
I'm going to keep it very short and say, don't forget your walk work. Vitally important for injured and sound horses.
Perfect. Let's see. We'll be out there, sort of walking, hacking our walks. Fantastic. I just also want to just remind everyone about our final webinar of the series is going to be sort of Wednesday the 26th, so that will be 2 weeks' time. We're going to be joined by equine behaviourists and trainers Trudy Dempsey and Justine Harrison to discuss how we apply learning theory to riding, and how this will be including how we can use positive reinforcement. So the link will be should be up in the chat now, so please do sign up for that webinar. And also, again, if you have any suggestions for our next winter series, sorry to talk about next winter already, please do email us at education@worldhorsewelfare.org with any suggestions you might have. So thank you again both so much. I can see loads of thank yous coming in on the chat as well. So I think so the presentation and the questions have definitely hit the spot. So thank you both very much for your time tonight. And I'm sure we'll be asking you back at some point in the not too distant future if we haven't scared you off too much.
Pleasure, Alana. Thank you very much. And thank you, Kim. It's lovely hearing your input too.
Thank you for having me. It's great to be asked and provide something back to World Horse Welfare, definitely.
And thank you everyone for attending.